Absolutely. So you mentioned girth versus length, and you just had a video come out very recently about girth versus length. And in fact, well, why don't you share what you found in that study that you reviewed?
I think the question in my video was like, what do women prefer?
Right.
I mean, obviously, a lot of the stuff in research is heteronormative, assuming heterosexual men and women. If you ask bisexual, homosexual, pansexual individuals, the question may be different. As far as heterosexual women were asked what they want, like what was more important, penis length or width or girth more important. And overwhelmingly, and this was a small study, 50 women, and overwhelmingly 90% of them said girth.
And that makes sense anatomically, right? Because the large majority of the nerve endings in the vagina, where it's most densely innervated, are in the first 2/3 of the vagina. And so that part is, and also we have obviously the clitoral tissue, which is above the urethra, and you can push on it when you have a girthier penis.
Yes.
Right? And so those are the things that you want to stimulate.
Yes.
And while some women find cervical stimulation pleasurable, that's not a universal thing. So I think more so those women may be more interested in length, but that's a smaller proportion. But I think generally speaking, the large majority of women, as you and I always talk about, need clitoral stimulation to have an orgasm. And if you can get it vaginally, it requires either manual stimulation or a very girthy sort of device or person.
Yeah, agree. It makes complete sense physiologically. Our pleasure box is partially located inside the distal or lower or more further out part of the vagina, and the clitoris itself is right outside in the vulva. So that surface area contact with the increased girth is going to feel better. And actually, I want to do this study in my practice, but I have multiple patients who tell me that their partner has noticed the difference after,
That's good. You should totally do that study.
I totally want to. I've had to tell at least 2 patients. I'm not the type of person who's just going to keep filling a penis until, the cows come home. I will tell somebody like, I think you're doing too much. Okay.
Right.
And so I've had 2 patients. I'm like, stop. It's good. Yeah. I don't think we do. And I had to ask them, like, why did they keep coming back? Why are you keep coming back? One of them said, my girlfriend is driving me crazy. She loves it. She won't stop talking about it. And she wants me to get more and more and more. And I was like, I said, please bring your girlfriend to my office because I need to sit her down and tell her, like, it's good. It's good. So and one of my other patients told me after a session that so I have a few patients who don't tell their partner, It's like a Christmas gift. It's like they're like, and she was like, apparently this is what he said, according to him. She was like, there's something different after they had sex, something different, and she came quicker and more intense and this and that. I was like, okay, win-win.
Good for both partners.
Good for both partners. Yeah.
And, it's interesting. There is a limit, right? Because there's actually been, so when we do penile reconstruction for trans folks and you make a new penis, a neophallus, we call, this because we did a lot of these. We were participated in their care in residency, but you use their forearm to create that neophallus and it can become very girthy. And they actually, the impetus for them studying what women want one of the studies came because they were making these neophalluses and they were like, oh, they can't actually fit into their partners.
They were too big.
And so they said, okay, we got to find out what the average woman needs so that we can make the average neophallus or, penis so that they're not too girthy, because what's the point of having one if you can't have sex with it? And so that's where the impetus came from, because they were actually too girthy.
I think it's, a lot of these surgeons doing them are, as surgeons are mostly men. So I think it's men creating the penis they've always wanted. And it's like, whoa, okay. Because we've seen them in residency. I remember thinking, I don't know where that's going to go. Like,
oh, I know. They were
huge.
We used to do penile implants in those patients. And that was, those were the largest size penile implants we would place.
Yes, absolutely.
But yeah, so anyways, I think that's really, really good. And then, I think generally speaking, my thought on fillers is that it's, as long as you know the risks and benefits, you're doing them, you've really outlined them nicely. So I think that's really good. So let's shift gears to women a little bit. Tell me about the cosmetic enhancements that women can have and what you're offering and what's out there.
Cosmetic gynecology, if you will, cosmetic genital surgery for women. By far, probably the most well-known and potentially the most common is labiaplasty. Mm-hmm. And when we say labiaplasty, we are specifically talking about the labia minora, and that is Those are the inner lips. Obviously, this is cosmetic. This is not functional. And it's not to say that there is an abnormality, okay, that we are correcting. Vulvas, labias, especially labia minora, are so vastly varied, okay? Some are more elongated and hang and protrude beyond the vulva, the labia majora. Some are hidden. Some are asymmetric. Your labia are not twins. They are sisters, okay? And so there are some asymmetric ones. And so a labiaplasty is generally to trim the labia minora with the desired effect of making this kind of more even vulva appearance where the labia minora don't protrude beyond the labia majora. And some people may refer to that as the Barbie look. I don't use that term. I hate it. For multiple whatever reasons. That is the design. So for some women, it actually causes functional issues. Yeah. For some women, that the elongated labia rubs up against certain clothes. They'll say like, oh, if I'm like sitting and I, move a wrong way, like it'll chafe. So they're more prone to chafing during intercourse or penetration. It's more prone to chafing and irritation. So there is legit functional issues with some people who have more elongated labia minora. And then for a vast majority of patients, they just want it to look the way they want it to look. Yeah. I think every new cosmetic thing goes through the phase of first being being very judged and controversial. I mean, there was a time I'm old enough to kind of sort of remember when breast implants were controversial. Yeah. I mean, now it's like commonplace. Who doesn't have a breast implant? Anyway, it's very commonplace, right? It's like, oh, okay, it's just going to going to the dentist is going to get my breast. Okay. So these things with labiaplasties, when it first came out, it was very controversial. What are we saying? What are the messaging that we're telling women? This and that. Why does this matter? I am definitely not, every vulva matters. Even with the penises, I don't want to perpetuate this whole thing where, size matters. With the vulvas, a certain vulva look is the look that you should have. But also, we have choices as adults. And if we want to have it look a certain way, we understand the risks and benefits. We understand the implications. Why not? Okay, so absolutely. I offer labiaplasty. I love doing it. Also an art. And those patients are usually really happy patients. And so that's the biggest one. And that's got millions and millions and millions of procedures are done across the country and the globe. Labial for the outer lips, they tend to, because our outer lips, the labia majora, tend to lose volume. And the aesthetic that people tend to want is a little bit of volume in their outer lips. There are things like labial puff. Okay. And labial puff essentially is volumizing the labia majora. Okay. Mm-hmm. So labia minora, we want to kind of trim. Labia majora, we tend to kind of want to volumize. And with labial puffs, we can use dermal fillers, i.e. hyaluronic acid, like we do in the penis. Great way, very safe way, reversible if we need to, dissolvable. So we can do that in the labia majora. Another popular way to do a labial puff is fat transfer. I didn't talk about fat transfer to penises, but fat transfer to the labia actually makes sense too. Because as we know, anatomy wise, the labia has fat in it. If you cut the labia, you'll see a bunch of fat blood vessels. And so you can get liposuction and put those fat cells into the labia. With fat transfer, with any fat transfer anywhere, there's going to be a significant amount of fat loss. So they actually make these huge looking. If you see a post-op fat transfer labia, you're like, the hell? It looks massive. Okay.
But they lose a lot.
Because you lose a lot. You got to put a lot in because you're going to lose, I believe half or more. Even with fat, it's not permanent. Fat get lost over time. It does tend to last longer than hyaluronic acid. So those are the two. I don't know of any other person who's putting anything else in the labia majora.
I wouldn't recommend it if they are.
No, absolutely. One thing about fat transfer to the penis that I really want to say is I think that doesn't make any sense to me because unlike the labia majora,
where there's already fat,
there is not fat underneath the penile skin.
Yeah, what is it? Where is it gonna? There's no. Yeah.
So what happens is you have I've seen at least softer erection. Like it's like now covered with fat.
Oh, yeah. That makes sense.
You see what I'm saying?
Yeah.
I've had, and I mean, I don't do fat in the penis for multiple reasons, but I've had patients who've come to me now when, hey, I want to get filler with hyaluronic acid. And a common complaint is like, it's like, I don't like the texture.
Yeah. And that doesn't happen with the hyaluronic acid filler.
It doesn't. It doesn't. Yeah. It actually feels real. Like it feels, I tell patients, it should feel like your normal tissue. No one should be able to tell by feel that you had anything done.
What about G-spot enhancement or clitoral enhancement? I've heard of.
Yeah. Famous G-spot that all of us are,
G-zone.
G-zone. It's a zone. It's
a zone. Yeah.
It's a zone. If you say G-zone, people are like confused. What are you talking about? But yes, we believe it's a zone, not a spot.
It's not a button you can look for and find.
It's not like,
let's just put
push
that out
here.
there.
Exactly. But involves the upper or anterior vaginal wall and the distal part, maybe a few centimeters in under the urethra. The urethra sits above the vagina. And we think it's the zone involves the confluence of the anterior vaginal wall, the urethra, and the clitoral bulb.
And the Skene's glands.
And the Skene's glands that wrap around it. Yep. Some people believe that the G-spot is a myth. It is not a myth. Okay.
I mean, it's like,
so I'm like, what? How is it a myth? You have
it's an anatomic area.
It's an area. It's
an area.
Yes.
Like, I mean, it's not not everyone is going to feel incredibly stimulated by stimulation of the G zone.
Yes.
Not everyone's going to orgasm through stimulation of the G zone, but it's an area. It exists.
It exists.
So I don't know why there
real.
would be. Yeah.
It's real. Okay.
Yeah.
Let's just put that to bed. It is real. Okay. So yeah, you can enhance this area by volumizing it, again, most likely with hyaluronic acid filler. And it's super simple procedure. This type of injection is actually relatively painless. We usually just put some topical numbing cream for a while, and then patients don't feel a thing. That can potentially enhance the area. Now, there's no guarantees that can be made with this. That's really important for patients to understand. Probably about 75% of patients will say, oh, this was worth it. I'm very clear about expectations whenever counseling. Yeah.
Is there any literature on that? Because I don't think I've done a deep dive. I don't think they've actually published anything.
There isn't. Yeah. So where did I get that 75%? It's on realself.com.
Okay.
So realself.com is like the plastic cosmetic surgery hub. Tons of, if you're like interested in any kind of procedure, about any kind of procedure that's cosmetic, you can go there. And there's something called a worth it. Like how many people who've had it who say it's worth it.
Got it.
And so every procedure has like a worth it rating, a percentage, and it's about, I think, 75% with the G-spot.
That's a good resource. That's great.
It is.
Put it in the show notes.
It is, yeah. And then there is platelet-rich plasma, and that can be injected to erogenous zones, primarily the clitoris and the G-zone. And that's by far probably more popular among, the public. They kind of know about it. They ask about it. But basically taking your blood, centrifuging it, taking the part of the plasma that is kind of rich in platelets and growth factors and that sort of stuff, and then injecting that directly into the clitoris, and then some also directly into the G zone. Also a very quick procedure. Done right, it should be painless. Okay. Mm-hmm. Done right, it should be painless. Variable results for sure, but can in some offer enhanced orgasm. Personally, I'm an open book, so I liked, and I'm also like, ooh, if I'll be like a guinea pig for a lot of things.
Yeah.
If I had a penis, I would have already tried fillers.
Yeah.
But I don't. But I have a vulva, I have a clitoris. So I did the PRP. Amazing. I mean, I will say amazing. I had orgasms before. This is not for somebody who's never
had an
orgasm.
It's just to heighten.
It's not there's so much work that has to be done in that individual that has never had an orgasm. I mean, I have many orgasms. I just was having less intense ones, and I got greedy. So I did this, and I was like, great.
So it worked.
It worked. It did. It did.
And is it lasting?
It's lasting. I am now about 4 months from doing it. So far it's great.
Interesting.
I was just thinking before I came here, I had sex, and I was just thinking, damn, this thing is good.
It's good.
It was like within 3 to 5 minutes, I'm like, already there. So I was like, this is great.
That's good. That's good. All right. That's a great endorsement.
Yeah.
But again, I don't think there's a lot of data on this yet.
There is not. There is not.
Hopefully there will be. Yeah. I don't know. And I think the reason these things don't get published is because people will still do them, right? Just like you want to enhance your orgasm or you want to enhance something. Like if someone tells you that there is a good experience and you can do this and it's painless, a lot of people will do it. And I think that's okay as long as you go to the right person. My biggest concern is that people start doing it with little to no training. They don't know the anatomy. They don't know what they're doing.
Yeah.
And they're doing it because they can.
Yes.
And people will, as you mentioned, like they'll still do it because they want to enhance themselves.
Yeah.
Which is not a bad thing. I don't want to like hate on anybody who wants to enhance themselves because why not? We all want to be the best version of ourselves and whatever that means to us. It may be for some people, general enhancement. For some people, it's like being as fit as possible. For some people, it's being as smart as possible, whatever it is, right?
Sure.
So I'm not hating on that. I just worry. The reason I harp on data is because I want people who do these things to be trained, to understand the risks and benefits themselves and know what to do if things go awry. Like, God, I don't think it's very likely that you're going to cause great harm by injecting platelets, but there's nowhere to say like, yes, this is successful because it's been studied against placebo. Like what if I just put saline into your clitoris or put saline into your G zone? Like would it do the same thing? I don't know. Hard to say.
Yeah, you can't argue with that.
Yeah.
And the data is very minimal. It's minimal. It's not compared to placebo. And there is potential for bias. Yeah, I think you're right. Like we have to respect what we do to people. And I learned that early in residency that like what we do, our department chair said that like we are like a loaded gun. And not just, and we want to be, we have the potential to be a loaded gun. You see what I'm saying? Like even the most routine thing, you have to have respect for that. So I don't take anything as routine, as 100% safe, as this and that. People ask me like, oh, is it like 100% safe? Like there's nothing that's 100%. Anything I do to you, if I draw your blood, you know what I'm saying? There's a risk. So you have to respect that. And we definitely have some clinicians, if you will, that are kind of the Wild West cavalier.
Yeah.
And that's when you get the rare, somebody got PRP in their face.
Yeah.
By, unfortunately, a practitioner who I don't think was trained the way you're supposed to be trained, but could do it. And, had significant complications. So you also got to know where you're getting it done.
Yeah.
Who's doing it.
And if you liked this interview with Dr. Fenwa Milhouse, make sure to check out the full episode on the Rena Malik MD podcast right here.